Hi, I'm Laura.
Hi, I'm Mike.
Today, I hear you have some questions about genetic testing.
Yes, I won't have a baby, but I am concerned because my family has a history of cystic fibrosis, and I want to know what the chances are that my child may have it.
Cool. Does it run in your partner's family?
I'm not sure, but I don't think so.
Okay. All right. So, oh my goodness. All right. So cystic fibrosis is a disorder. Well, how much do you know about cystic fibrosis? I guess we should start there.
Not much.
Okay, well, I guess we'll start there. So it's a disorder caused by one or more mutations of both, it's called the cystic fibrosis transmembrane conductase regulator, or the CFTR gene. And these alleles cause a disruption in the CFTR protein. This disruption alters the body's natural fluid balance and causes transportation of chloride across the cell membranes in the body to cease, which traps the chloride in the cells. So this causes the mucus in the lungs, the liver, intestines, and pancreas to just become really thick and sticky. I have a picture. Look at my... Yeah, so
oh, wow.
The lungs become all sticky with
right.
Yeah. We'll put that down there. Where was I? Oh yeah. So in the lungs, the mucus, is all nice and slippery and lets everything go through.
Yep.
Like you cough up. And in the lungs, when you have cystic fibrosis, the mucus becomes really thick and sticky due to the imbalance in the fluid status, and this obstructs the airway because everything gets stuck in your airway. It all gets trapped. And in the lungs, it also traps bacteria, which causes inflammation, infection, and it can cause respiratory failure. It's a good time. Can lead to death.
That can't be good.
No, it's not good. Mucus accruement or buildup in the pancreas blocks digestive enzymes, which assist with breaking down nutrients in food. So when you have a blockage of these, it leads to malnutrition and low growth rates. By blocking the common bile duct, the mucus can cause liver disease and possible failure, like in alcoholism. So if you have cystic fibrosis and you're an alcoholic, you're in trouble. And in men, which would affect you if you had cystic fibrosis, which doesn't look like you do, cystic fibrosis can affect the growth of the vas deferens, which is the tube that carries the sperm toward the ejaculatory ducts, which increases the potential for infertility. Yeah. So, does that all make sense?
It does.
Good. All right. So I guess we'll move on to how cystic fibrosis is inherited. So it's typically inherited through an autosomal recessive pattern, which means that you need to get both gene alleles from both parents in order to get it.
Okay.
So I'll explain that in a little minute. And it's caused by a mutation of both of the CFTR gene alleles, which are located on the chromosome 7q31, which isn't really important unless you really want to get into the nitty-gritty of it.
That's okay.
Good. And it can cause, and over 1,700 different mutations have been identified to cause cystic fibrosis, which causes a lot of variety in severity, age of onset, and the organs affected. So sometimes it can just affect your lungs and your pancreas, or just your liver and your lungs, but most of the time it affects your lungs and something else. The most common mutation in Caucasians, which is the most likely race to be affected, is the delta F508 mutation, which again isn't really important unless you want to get into the nitty gritty, but it's the most severe type of cystic fibrosis. Yeah. Do you know if that one runs in your family?
I'm not sure.
Not sure. That's okay. When we can do some genetic testing and find out.
That's what I'm here for.
Well, this is just counseling right now, just to see if you need testing. Yes. So to diagnose homozygous expression of, which is when both of your parents have it, and,
Okay.
and they give it to you, which again, I'll draw you a little picture in a minute. Homozygous expression of cystic fibrosis, the physical signs and symptoms are assessed, and the individual undergoes a sweat chloride test, which is basically they make you sweat and then they test the amount of chloride in your sweat.
Okay.
Yeah. So a positive result is indicated by a concentration of 60 to 200 milliliters equivalent per liter, but again, that's just a measurement. The normal of that is between 5 to 50. So if you have anything bigger than that, we're worried. And for heterozygous carriers, which means you're just carrying the potential, which is what you might be.
Okay.
The potential for cystic fibrosis, genetic testing by direct sequencing of the CFTR gene, which is the gene that expresses the cystic fibrosis mutation, is necessary. So it'll denote a carrier status and decide whether or not you will be the one to pass it on. Yeah. And this testing can be done on women, and it can be determined whether or not the fetus will be affected. Yeah, so obviously not for you, but maybe for your partner.
I'll have to bring my partner in.
Yes, we'll have to get there. Yes. Anyway, so yeah, cystic fibrosis typically affects about 1 in 3,000 live births, and is most common again among Caucasians. But it can happen among other races. Is your partner Caucasian or just you?
Yes, she's Caucasian.
She's Caucasian too. Okay. All right. Very nice. So that increases our risk a little bit, but again, we'll get to that. Yeah. So screening for cystic fibrosis is available countrywide and is performed within the first month of life typically. So if you do have a child, we could screen for that. If you guys don't get testing before. Okay. But it sounds like you might.
I think we're going to get the testing.
Yes. Sounds like it. All right. I guess we can talk about how it's transmitted. So I'll get you the pictures. All right. So cystic fibrosis, again, is inherited through an autosomal recessive pattern. Meaning that both parents have to carry the genetic mutation to give the child the disease. So if neither parent carries the mutation, then none of the offspring are going to be affected. If one of the parents, I'm going to just draw a little square really quick. So these are called Punnett squares. We use these a lot in genetics to show the risk of offspring being affected. All right, so the big C is just normal, no CF. I'll write that down here. And little c is positive for CF, or you're carrying it. So if one parent has no mutation and one parent is a heterozygous carrier, which means they're just carrying it, but they don't actually have it. So it's going to be a big C and a little c, and a big C and a big C. And so we do our little square here, and this essentially is just going to show that 50% of the offspring are going to be potentially be carriers, while the other 50% will not be affected at all.
Okay.
Yes. So if both parents are heterozygous carriers, which means they both have that little C. Hold on. Then that increases our risk a little bit here. Oops, that's little C's. So then you have a 25% chance of one of your offspring contracting CF, while you have a 50% chance of them being a carrier and a 25% chance of them not being affected at all. All right. And if one parent has CF, so they have, both little C's, and the other is not affected at all, then, hold on, draw it out. and it's likely that 100% of their offspring will be carriers. So if this, it doesn't sound like it's in either of your parents affected by CF.
No.
Okay, so doesn't sound like your case.
Good.
But might be one of the others. And our final case is if both parents have CF, and essentially if both parents have CF, 100% of the offspring are going to have it too. Do you want me to draw out the square for that?
No, thankfully
Okay.
that's not an issue.
Okay, good. Perfect. Didn't sound like it. Do you know any of the signs and symptoms of cystic fibrosis?
No.
No? Okay. So, if cystic fibrosis is affecting your lungs, then typically you'd have signs like wheezing, exercise intolerance due to breathlessness. You'd have repeat lung infections and inflamed nasal passages or a stuffy nose from all that mucus. And you'd have a chronic, which means you'd have it all the time, or at least 3 months of the year. You'd have a chronic productive cough with thick sputum, which is mucus.
Sputum.
Yes, sputum. And allergies that would last year round, mostly due to the amount of mucus again. And you'd also have persistent sinus infections, again, due to the bacteria that's getting trapped in the mucus. With each passing year, your lung function slowly is lost due to the progressive buildup of mucus, and it slowly clogs off your airways. So it's really important to do the treatments if you have cystic fibrosis, which, again, sounds like you don't.
No,
thankfully. But if your offspring does, they'd have to worry about this.
Right.
So some the digestive symptoms, because again it can affect your intestines, because that mucus is produced in there. Those would be poor weight gain and growth, intestinal blockage, which typically affects newborns, and you get newborn poop is called meconium.
Meconium.
It's a special kind of poop. It's different than adult poop because, again, babies drink milk, so it's a little more wet. But it's called a meconium ileus, and basically they can't poo.
Oh no.
I know, poor babes. Yeah. And more digestive symptoms would be frequent, large, foul-smelling, greasy stools. So don't go in the bathroom.
Uh-oh.
Severe constipation, consistent pancreatitis, which is severe inflammation of the pancreas, it's really painful. And symptoms of hyperglycemia or high blood sugar. And those would include frequent urination and constant thirst. And other symptoms would include skin that would taste sweaty when it's kissed or licked, which is pretty interesting, and excessive sweating, so it'll be super salty.
Gross.
I know, right? I know, yeah. So if your child does end up having cystic fibrosis, there are treatments, but that's not a cure for the treatment, or for cystic fibrosis. It just kind of slows down the disease progression. And cystic, so, you know, like 15 years ago, people with cystic fibrosis wouldn't really live into their adult years, but now more and more are living longer and longer lives. Some even live into their late 20s and 30s.
Wow.
Yeah, it's very exciting. So treatments will include airway clearance therapy, which I have a picture of, and we'll explain a little bit more in a minute. Enzymes and nutrients to help with those digestive symptoms. Medications to thin mucus, and antibiotics and anti-inflammatories to treat all of those infections that they get. So the airway clearance therapy, which a little picture of, is done with manual chest physiotherapy. So that's that jacket you see there. And it vibrates and shakes loose the mucus in the lungs, theoretically. And also in his mouth, he's got, that's either a nebulizer or a flutter device. And the flutter device is you breathe it in, and it vibrates as you breathe in, and it also helps shake that mucus loose. Yeah.
Okay.
Yeah, it's pretty interesting. Let me just put that down here. So well, I mentioned the nebulizer. So while performing airway clearance therapy, a nebulizer or inhaler like albuterol Dornase alpha or hypertonic saline solution is used to thin mucus and relax the airway, which this is useful during that airway clearance therapy to really get everything moving and get all that mucus out. Yeah, gotta make sure the lungs are clear.
Yep.
Yeah. And to help with the low weight gain due to the intestinal and digestive blockages, pancreatic enzyme replacement therapy is used to help absorb essential nutrients. These are taken before eating anything.
Okay.
So it's a lot of pills. And due to frequent bacterial infections, antibiotics are commonly prescribed to those affected by cystic fibrosis. It's not an all-the-time thing, but they have them a lot, so it kind of becomes one. And are usually given orally or via inhaler, unless the individual is very sick, and then they have to go to the hospital for IV therapy.
Oh, no.
I know, not good, but we like to catch it before then. And anti-inflammatories like azithromycin and ibuprofen, which you might take, are used to calm inflamed airways to allow for better mucus clearance.
Oh.
Yeah, very exciting. Yeah. So do you know about any current research on cystic fibrosis medications? Sometimes people hear some stuff in the news.
I've heard of it, but
Yeah.
tell me more.
Okay, yeah, we'll talk about it. So current research is mainly focused on treatments for cystic fibrosis because there's really no cure since we can't alter the genetic mutation. They're mainly focused on specific mutations like the delta F508 mutation that I talked about earlier. There's not a drug specifically for that one, but we'll mention that one. So an example of that would be it's called ivacaftor or Calideco, and it's recently approved for use in children as young as 6 months old with one of 38 specific mutations. So really wide range.
It's a lot.
Yeah. There's a couple other medications that include that med that are used to treat the F508 G mutation. That's the most severe type. Yeah, but I won't bore you with all that.
All right.
It sounds like you're not really interested. Yeah. So, do you have a support system for if you and your family are affected by cystic fibrosis?
No.
No? No, you are your friends and family around to support you?
Yes,
okay.
yes.
Okay, there.
Yes.
Sorry, I worded the question a little weird. Yeah, so this is really important because people affected by cystic fibrosis will never really get better, and this is really hard to deal with, especially for family members and parents, because you helped birth them, you're never gonna get better. Yeah, so, and caring for someone with cystic fibrosis is really taxing, because it's a lot of work. You have to do a lot of the therapy a lot of the time, and you have to take your medication before you eat, and la-di-da-di-da. Yeah, and it affects everything, like all day-to-day activities. This can be really stressful. Yeah, and if you do have a child with cystic fibrosis, they may never really feel like normal kids, which can be really hard for them. And it can lead to higher instances of depression and anxiety in these children, which is hard. Yeah, but if you have a good support system and you seek out counseling, there's ways to fix this. Yeah. Yeah, and there's also a lot of community resources out there too. Like the Cystic Fibrosis Foundation, and they have another one called the Cystic Fibrosis Foundation Compass, which is a specific. It helps you find organizations in your area, which is pretty cool. And then there's the Boomer. Oh, I'm gonna butcher this last name.
Esiason.
Esiason Foundation.
She was in the NFL.
I didn't know that. That's very cool. Sounds like he was affected by cystic fibrosis.
I believe it was his son.
Oh, well, it sounds like you know a little something about cystic fibrosis. And there's also the Claire's Place Foundation. Yeah, that's just to name a few.
All right.
Yeah. Do you have any questions?
Well, I think we're going to do the testing.
That sounds like it's probably a good idea. Is there any history in your partner's family? Did I already ask that?
I wasn't sure,
You weren't
but
sure?
I don't think so.
Okay, yeah, so definitely would suggest testing just to make sure that you don't have any risk. Yeah.
Great.
Great. All right, so nice to meet you.
Thank you very much.